Hi, my name is Dr. Nguyen. Today I'm going to discuss with you how to place and interpret skin tests, both brick and intradermal. Okay, before we do so, let's talk about the mechanism of allergy. So, when you're allergic to something, this is what happened to you. You exposed to tree weeds and grass, dust mite, and dog cat, and when you inhale it, it goes to the bloodstream. Your immune cell called B cells will make IgE antibody against it. And this is the same mechanism for food allergy as well. Your body make IgE, that's make you allergic person. Next time when you're exposed to the antigen again, the antigen and the antibody will bind to each other, and then they bind to another cell called mast cells. So when the binding occurs, the mast cells start release histamine, will make you itch, sneeze, sneezing, watery eyes. That's what Zyrtec, Claritin, Allegra, and Benadryls are for. And it release cytokine, make you stuffy. That's what Flonase, Nasonex is for. And release leukotriene, make you congested. That's what Montelukast, or the brand name is Singulair, are for. Okay. So when we do the skin test, we place on the patient's skin what they are allergic to. So there are millions of these mast cells underneath your skin. If the patient is allergic to a certain thing, the mast cell will be activated and release histamine chemical, and therefore we can read the test as positive when there's a histamine response. So when we, from the above mechanisms, we learned that the presence or absence of histamines is important in skin test reading. Therefore, we do a positive and we do a negative control, okay? So that we can read the result correctly. If the patient takes some type of antihistamine, the positive control will be negative and the entire test will be completely invalid. So here this is a positive control test, which is a histamine you place on the patient's skin, and this is the negative control, which is water. So sometimes you see a positive control look like that, and that test, you can't do the test because the entire test will be completely wrong. Some patients have a sensitive skin, so the negative control will show some response as well. We will talk about later, and this situation is called dermatographism. So in this case, you have to be very careful because you will run into a false positive test, which means the test is positive, but it's not true. So again, this is how I measure a negative control. You got probably about, this is I would call 0 to 3 millimeter wheel, and there's no redness at all. When you have a positive test, here we got about from here to there, you measure about 6 millimeter, and the redness you measure from here to here, you see the redness around it. You see the halo redness, and that's about 30 millimeter. Okay, let's talk about the ruler. So the ruler here, this is in millimeter and in centimeter. So from here to there, that's 1 centimeter. 1 centimeter, 2 centimeter, and each small line is 1 millimeter. You have 10 millimeter in 1 centimeter. So from here to the halfway is 5 millimeter, 10 millimeter, 15, 20. Okay, so when we measure the skin test, we read in millimeter, not centimeter. Okay, so you read on that from the small line right here. Okay, so let's talk about how to place individual brick skin tests, and I let you watch the video in a little bit. When we place a test, this is we call T1. You want to make sure to get enough liquid in the well of the tray so that you can transfer to the patient's skin test correctly. If the tray the tray does not have enough liquid, you need to make sure to fill it. You don't want to fill too much as well, because when you fill too much liquid will drip everywhere and it can make a big mess. So when you skin test, you have to push down the brick firmly on the skin of the patient, and you can do a single brick or multi-test here, and the pressure should be the same for either test. You do not want to break the skin. Again, there should not be bleeding here, but you want to make sure you push down firmly enough to create a small impression on the skin. Okay, so let's watch. This is how she does it, and I think she did a good job. So it's a firm push, but it's not too hard, but it's not too light. So for the brick test, if you do on the back of the patient, it is best for the patient to lie down on the stomach instead of sitting up to prevent the liquid from dripping down. I would advise not to remove the excess liquid during the first 10 minutes yet, unless you are worried that liquid will drip down and cause contamination to the surrounding area. Also remember that the upper part of the back, right here, is the most sensitive part. Okay, so which means that's the best place for you to place the test. While the lower part is not as sensitive as the upper part. But it's fine. You need 80. You have to do it all. But if you do food test, it may be best to put up here for the food testing, not put over here for the food. I also recommend to avoid placing the skin test directly on the patient's spine, since it can be quite uncomfortable. Okay, so let's talk about how to place multi-brick skin test. So for the multi-test, usually we done for children. I like the firmness is about the same, and sometimes I seen the nurse, she would rock the test back and forth, and I think rock 1 or twice is fine. In this video, she rocked a little bit too much, but it's okay. There you go. So just rock 1 or twice would be good enough. Okay. So that's the multi-brick test. So let's talk about how to read the test. So remember this, skin test reading is not easy. Okay, it can be easy, and I will make it easy for you, but it's not easy, especially at the beginning. It requires a tester to pay very close attention to the details at all times. You may have a hard time reading the test at the beginning, but you will get used to it. But then, even you get used to it, you may move so quickly when you're in a hurry, and there's a chance you may write down or transfer the result to the computer wrongly, and that will be really, really bad because all the result will be wrong. Therefore, I stress the importance of being attentive and extremely careful when you read and transfer the test result. Okay, so I would like to show you a simple way to read the skin test. So for the first part, the T1 test, if you look at the grading for the brick scale, it can be very daunting. Okay, it can be very daunting, but so you got 1 plus, 2 plus, 3 plus, 4 plus, and with a lot of number to remember. But I just want you to remember 2 numbers, 5 and 10. Okay, 5 and 10. We have 5 fingers on one hand and a total of 10 fingers on the other hand, right? For the both hands, right? So simple, right? So for the gray one, zero or 1 would be negative. Okay, they didn't put 0 here, but basically 0 is nothing. So grade 0 and 1 is considered negative. 2 and above are considered positive. So it's very important for you to differentiate between a 1 and a 2, because that's how you can define a negative and a positive test. So 1, 3, and 4 are no-brainer. You will see it's easy. But what make a 2? Okay, so what make a 2, which is a positive test, when you have a 5, at least 5 millimeter wheal. A wheal is a bump, and 10 millimeter redness. Okay, and that would define a positive test. Okay, so sometimes patient can have, and this is not a perfect example, but sometimes patient can have some redness around it in case of dermatographic patient, but they have a very small wheel, so the wheel is smaller than that, and you can call the 1. Okay, sometimes patient can have a large wheel like this, but they do not no redness around it, so just the wheel, but pretend just no redness here. So with that, you have to call it a negative test. What I want you to remember, so in this case right here, let's say if this is a big wheel bump, like a 5mm wheel, but there's no flare, no redness, that will be a negative test. But one thing you really have to remember, if there is no redness, there is no histamine release. So the test will be negative, okay? Sometimes you have to step back and compare with the positive and negative control as well. Whatever look like a positive control, it will be positive. And whatever look like a negative control, then the test will be negative, okay? Let's go back to this. Now we know how to identify a positive test. Grade 2. Grade 2 is a positive test. So if you have a pseudopod, pseudo means fake, pod is like leg, right? So if you have a pseudopod, and I show you what pseudopod in a little bit, then or a wheel greater than 9, which is a 10. So if you have a pseudopod and the wheel is 10 and above, then you will call it a 4. Okay, so basically 5 wheel 10 redness, grade 2. 10 wheel or pseudopod will be grade 4. Anything kind of between a 2 and a 4 is a 3. So if you got about 7 and 9mm wheel with a lot of redness, you call it a 3. It's just a slight pseudopod, just a little pseudopod you call is a 3. So just don't stress out about that. So for the food testing, it's important to know the exact measurement of wheel and flare. Since the provider and parents, we follow the trend of the skin test for the food with the hope that the children can outgrow the food allergy. Okay, so therefore I recommend staff to put down the grading for food skin tests and also document and save the exact number of wheel and flare when you measurement of the food. So again, for the grade 3, if you overread or overread or underread a little grade 3 a little bit, you call it a 2 or you call it a 4, it's okay too, because it's still a positive test. Okay, so again, let's go over this. This is a negative test. Okay, the wheel is small and there is no redness. There's no redness, there's no histamine response. So that's a 0 negative test. On this test, you got a perfect grade 2. You got a 5mm wheel and then about 30mm redness. So that will be grade 2. Okay, remember 5. You need 5 and greater than 10 would be fine. Okay, so you don't call it a grade 3 because the wheel is the first factor you depends on. Okay, so here you have grade 3 because you have a slight pseudopod. This is the little pseudopod here I'm talking about the little leg. So that when you measure, you have about 8mm wheel and probably about 25mm redness. So that will be grade 3. Okay, grade 3 you have a slight pseudopod, and a grade 4 would be huge. Basically, the wheel had to be equal or greater than 10mm. So from here to there is 20mm. And then the flare is just everywhere from here to there, probably greater than 50mm. Okay, so one that's 10, 20, 30, 40, and it's go all the way over here, so it'll be greater than 50mm. Okay, so now you know how to read the test. Okay, this patient is a perfect example to read the test. Okay, you will get used to it. You won't need to measure anymore eventually, but at the beginning you want to use a ruler and measure them. But once you get used to it, after hopefully about 2-3 months, you can just carry the ruler to carry the ruler. But you can read, that's a 0, 0. And then you got this one, it's 5 over probably 15. I read so many of the tests, so I get used to it. I know this is about 5 over 15, so that's a perfect 2. Again, look for the redness. If there's redness, a histamine response. This one, you got a little pseudopod here, and it's probably about 7 millimeter. So this is a 3. So 0, 0, 2, 3. Again, you want to guess? Think about and guess before I give you an answer. This is a little slight pseudopod. It will be a 3. With redness, either it's probably about 8 millimeter or slight pseudopod. That's the grade 3. This is a perfect 5. 5 over probably 10, so that's 2. This is the pseudopod, perfect pseudopod right here. And that's a 4. That's a 4. This is a pseudopod, perfect pseudopod. If you measure, probably about 15 millimeter will and about 40 millimeter redness. Redness you can measure from here to there. And don't stress so much where it will be. Is it right here or right there for the redness? It's not a big deal. It's a 4, okay? And this is a 3. So again, 0, 0, 2, 3, 3, 2, 4, 4, 4, 0, 0, 3. Okay, so that's how you break skin test. You read break test. So when you can read the skin test for dermatographic patients, you may consider for the patient with sensitive skin, we call dermatographic. You may consider inform your physician and sending blood tests instead because the test can be very tricky. However, if the patient or providers are insisting on the brick skin test, you can actually apply using the guideline from our allergy textbook. And this is the guideline. The guideline would say a positive test is defined as will with 3 millimeter above the negative control. Okay, so I repeat. A positive test is defined having a will with 3 millimeter above the negative control. Okay, so this is a positive control. We got probably about 2, level grade 2 here, 5 over 10. And this is a negative control. A negative control, when you measure it from here to there, probably about 3 millimeter will and about 6 millimeter redness. So this is a perfect example of level 1, level grade 1, grade 2. So this is the same patient. This is the left arm and this is the right arm. So if you got a dermatographic patient, the skin test is in a negative control, positive control, and we place a C-rack. A C-rack is the one with dog, cat, and then 2 dust mite. When you look at this is a positive test because it's about 7 millimeter and it have a pseudopod. A 7 millimeter is definitely 3 millimeter above a 3 millimeter here for the will. So that would be a positive test. All these are negative tests. Even though it looked like a 2 to you on a normal patient, in this dermatographic patient, all of these are negative. Only the dust mites is positive. So again, positive test is defined with will 3 millimeter above the negative control. Again, if the negative control 3 millimeter will, 10 millimeter redness, and positive test would need to have at least 6 millimeter will and also greater or equal 10 millimeter of redness. Okay, so let's take a look at the movie for the intradermal. For the intradermal test, you actually create a little bleb underneath the skin, so there's always a little bump there. Okay, so let's see how she does it. Okay, so it's pretty good. So reading the intradermal skin test, okay, again, when you look at the grading, it looked pretty intimidating, lots of number to remember. But I want to simplify for you. I just want you to remember one number when you read intradermal: 5. 5 millimeter will with redness, plus redness. So the most important thing for the intradermal test, look for the redness. So without the redness, you won't have a positive test, okay? And you want to be at least 5 millimeter will. You can have A or pseudopod or whatnot. It's fine. It's still a positive test. It's good to know some 4 with a pseudopod, but usually when we do the intradermal, this is what we usually see. We see a little bump and a redness. Okay. So on this test, I'll let you think about first and let yourself know which one is a positive test. There's only this one and this one is a positive test. Yeah. Because there's no redness here, no redness beyond a 5 millimeter. So again, no redness beyond the 5 millimeter will. So that will consider all negative tests except this one. We got about 5 will and probably about 15 millimeter redness. Same thing with this as well. Okay. So there are several caveats about the skin testing I want to talk about. So reading skin tests on the dark skin patient can be very tricky. I was told by the staff sometimes you can wipe off using the alcohol pad or using a cotton ball. It may help showing the redness, okay? But for the dark skin patient, you really rely on the will. And then you compare with the positive control. So this is actually a positive control, and this is a positive test. We got some pseudopod. Here's the egg the patient allergic to. It's so hard to read the redness here because it was placed on the area we call hyperpigmentation from the eczema skin. So it's so hard to read the skin test. We end up repeat the egg again elsewhere when his skin's a little lighter, and it was a beautiful level 3 afterward. So this is a positive test. You may need to use a flashlight or turn the patient back toward the sunlight so you can see the redness better. So again, this is a positive control with 5 millimeter will, and you got the redness around this. Okay. Skin test can be successfully performed and read by 4 months of age. A lot of patients come and say, what is the earliest age you can test? 4 months. So studies show 4 months of age, the mast cells activated and you can perform the skin test. I'm pediatric trained, so my clinic is like a pediatric office. We got a bunch of little kids come in for food allergy. So I can test them 4 months of age. I do not test them for tree, weeds, and grass. Those are outdoor allergens until 2 years of age because it takes them at least 1 to 2 years. They have to live longer, 1 or 2 years, for the body antibody. Again, you remember the IgE. For the IgE in your body being produced, then you make you an allergic person. But I can test for dog, cat, and dust mite. Those are indoor. The patient exposed since birth or food by 4 months of age. Okay, both very young and very old patients, or like 75, 80 years old, may have problem with the false negative skin test. Negative but not true. Okay, you may run into sometime a positive control is not responding in elderly patient. Despite the patient have avoid all the antihistamine, green tea, or multivitamins. So aging does have effect on our skin test as well. Young infant with skin test who have a good positive and negative control, sometimes the reading of 4 millimeter will with the 8 millimeter redness may consider positive already. Okay, so you really don't have to reach 5/10 as a grade 2 for these little kids. especially when the negative control is completely negative. Why is that? Because the antibodies are still, the level is pretty low, they're very young, and the mast cells are not, the skin is not very sensitive. So you may not need a 5/10. If so for us as physician, we have to use the clinical symptom of the patient to support our skin test finding. Therefore, it is important for the staff to document will and flare result for all the food tests. So for example, the kid came in, mom say the kids have egg and have hives everywhere. When you put the egg on the skin and you got a 4/8, you say, well, it's not 5/10. So you call it a negative test, you call it a 1, but which is true. But to us, that was a positive test, especially on this kid. So for patients who are very allergic, you increase risk of systemic reaction in a very allergic patient. Okay, so you must stop the reaction quickly right after 10 minutes and give patient antihistamine. Do not proceed with the ID skin test on the same day. Okay, so remember, we set the alarm to check on patient 10 minutes after placing the test so that we can make sure everything is okay with the skin testing, right? You really want to look for a significant reaction to the skin test at this point after 10 minutes alarm went off. If that happens, I recommend you to use a piece of tissue and gently remove excess liquid allergens on the patient's skin. This way we can prevent worsening reaction. It is very unlikely, but I personally have treated patients with systemic reaction to the skin test. Too much histamine release on the skin test can lead patients to have hives all over the body and respiratory distress, especially after you've done all this brick test and you say, oh, well, let's do more intradermal, and we inject some of the negative one on him, then he might get into trouble. Okay, and this is also a reason due to the systemic reaction to the food allergens is high. Therefore, we do not perform intradermal for food testing. We only do intradermal for the environmental testing. So this young man, he is very allergic. This is a 10 minutes reading. He got a bunch of pseudopod. All of this is grade 4. You can read it now easily without measuring. So actually for this patient, the MA calls me, and then before she let him sit up and read the test, I gave him 2 Zyrtec. Sometimes you can do a Zyrtec and 1 Benadryl. A Benadryl works faster within 10 minutes. So Benadryl works faster than Zyrtec. It works within 10 minutes. Zyrtec takes about an hour for it to start, but Zyrtec lasts longer, while Benadryl only lasts about 4 hours. Okay, so these you got a 4, 4, 4 here, and a 3, and a 4, and maybe even a 4, 4, 4, 4. So most of his tests are 4. This might be a 1, and that's a 2, that's a negative, a 4, a 1 here, and then 1 here because we don't see any bump. It's just a redness. So that's just redness without bump. There's no 5 millimeters. You cannot cause a positive test. Okay, so this is a pretty good 2, and then a good 2 here, but all these are big 4. Okay, so I hope you learned something from me today. Well, thank you for listening. Goodbye.